Hello and welcome to our Menopause Cafe specialist talks. This month we've got Jackie Robertson, pelvic health physiotherapist, joining us, and I will hand you over to Jackie to do her talk. Thank you.
Thanks, Bernie. Hi, as Bernie just said, my name is Jackie Robertson. I'm one of the pelvic health physiotherapists in this trust, and I treat predominantly women, although we do see males in the pelvic health team. But today we wanted to really talk about menopause and pelvic health and physiotherapy and what we can do, what we treat, and some of the taboo subjects around the menopause and physiotherapy and pelvic health. So as I said, I'm a pelvic health physiotherapist and I treat predominantly women. So I see women who do sport, women during and after pregnancy, but women during midlife period is the main demographic that I would say. So before we get down to the nitty gritty, I don't want this to be like a moan about the menopause. I'd like it firstly to be educational, but most of all to show that you're not alone in this journey, and that there is help and support available. And it's not all doom and gloom, even if it can feel like that at times. So I wanted to really cover the taboo subjects in menopause. So taboo means prohibited or restricted by social custom. Should the following things be taboo, off limits, unspoken about, or are they just poorly understood? I thought I would just cover a few of the statistics to highlight the prevalence of the problem that we see within pelvic health and that women experience during this time. So 1 in 3 women will suffer some form of urinary incontinence at some point in their life. It's estimated up to 50% of women will experience some degree of prolapse. Vulvovaginal pain, itching, burning, dryness can be experienced by women at any stage in life, but is a complaint of up to 70% of women in peri and postmenopausal years. But studies show on average only 7% will seek and or receive treatment for these issues. A lot of women lose their libido, experience discomfort, pain, decreased sensation and decreased ability to orgasm during the midlife years. Is this okay? Do we have to put up with this? Aging can bring its own issues, but what we do now sets the scene for our future selves. Addressing the issues as they arise, even if they feel embarrassing or taboo subjects to discuss out loud, is really important. This is a transitional period in our lives, so seeking the right help, support and guidance is the key to manage our future health and well-being. So pelvic health physiotherapy, what do we do? So we try and provide you with a safe space to discuss some of your most intimate issues. We look at the interaction between the biological, physiological and social stroke environmental issues that are going on in your life. These topics can be extremely difficult to discuss for some people. And as pelvic health physios, we listen and we hear. We try to work with you and help you back to where you want to be and manage these issues in the best way possible for you. The aim being to get you back to the activities you want to be doing without the fear of embarrassment. Physio is classed as a conservative management and most of the time advised in the guidelines as first-line treatment. But we always work as part of the multidisciplinary team because you are just not a body part or a leak or a pain. Over the next few slides, I'd like to talk about some of the taboo issues we may experience as women transitioning through the peri to postmenopausal years. So, bladder issues. Some of the most common bladder problems you may experience or hear about are stress urinary incontinence, which means leaking when you cough, sneeze, laugh, jump, run and things like that. Usually an inability to manage pressures and changes in pressures that occur when these things happen. Urge urinary incontinence is an overwhelming sudden urge or need to wee with no leaking, but this sudden overwhelming urge before you can get to the toilet, and sometimes that can happen before you get to the toilet. You can leak, and it's usually when you put the key in the door, when you turn a tap on, things like that. This can be due to changes in the vulval, vaginal or bladder tissues, such as loss of estrogen, increased tension, stress, pain, or change in the natural pH balance of the tissues, or it can be a neurogenic component. Urinary frequency is classed as needing to weigh more than 6 to 8 times a day if that's not your normal. Postcoital leaking is a loss of urine with arousal or climax, a feeling of burning, itching, or like you're on the edge of a urinary tract infection, thrush, cystitis all the time, can be due to some of the tissue changes also. Seeking antibiotics without confirming it's an infection is not great, as this could be the changes we are experiencing in the urogenital tissues, and antibiotics may not be required. So moving on to the bowels, the one everybody hates to talk about. Fecal urgency means a sudden overwhelming urge, need to go to the toilet, you need to get to the toilet now, and that can be with or without leaking. Incontinence is an involuntary leaking of feces or wind, and constipation means going to open your bowels less than 3 times a week. Straining, pain and bleeding associated with trying to open your bowels. And after you've been to the toilet and you've passed some stool, not having that sense of satisfaction afterwards can all be classed as constipation. And then you have difficult or obstructive defecation. That means wanting to go, having the urge and the need to go to pass stool, but you may not have to apply some pressure for assistance to help that stool be removed. And then moving on to the big topic is the vulva, vagina and pelvic floor muscles. A lot of women are not sure of their anatomy, what it is, where it is, and very rarely check their genital area for changes like we would our breast, for example. This is never a bad habit to adopt, as it's the only way we know if something has changed or looks different. The vulva is everything that you see on the outside, and the vagina is what is inside. The vagina is a canal that connects the uterus to the outside of the body. The pelvic floor muscles are a group of muscles that form the floor of the pelvis, like a 3-layered hammock. They are not visible, so often get overlooked. They have 5 main functions: that's supporting the pelvic organs from above, stability as they act as part of our stabilizing core system, sphincterics as some of the fibers wrap around the openings and allow opening and closing as required, and sex, they are involved in a sexual function. In fact, an orgasm is a rhythmical contraction of the pelvic floor muscles. And finally, they act like a sump pump, aiding blood and lymphatic flow in and from the pelvis. So although we can't see them, they play a huge role in our pelvic health due to the general stresses, strains and different changes that can occur in the muscles. They can stop working as efficiently in this period of our life. But muscle is super clever, as it can be retrained and retaught to work more efficiently, and the pelvic floor is no exception to this. So leading on to our sexual function. So as women, I wanted to cover this one because it's not something that gets spoke about seriously enough, and certainly nothing that gets asked about in medical terms as often as it should be, maybe. So I wanted to cover this today, as I know most people know that if they leak, help is available to them, even if they don't seek it. But most women don't go and seek help if they experience any sexual issues. So what does sexual function mean to you? It should mean being able to participate in sexual activity of your choice without pain, leaking or fear. If you are experiencing any dryness, soreness, itching, things like that around the genital area, try some organic pH balanced vaginal moisturiser. This can soothe and replenish moisture. Use a good quality lubrication when participating in sexual activity. Don't use perfume products, as the pelvic floor and vagina are self-cleaning tissues in that area. Avoid wearing tight clothes and excessive wiping when you go to the toilet. Try pat and dry yourself instead. If it does not feel any better using these techniques and strategies, speak to your healthcare professional, as it might be something as simple as trialling a topical estrogen that works locally to replace the estrogen into the affected tissues. If you experience or don't experience any of the words on this slide, would you seek help or advice? I just wanted to make you aware that although it may be common, there is help and guidance out there. Your GP, consultant, psychosexual counsellors, specialist menopause clinics, and of course us pelvic health physios are there to help guide you in this area with these problems. As like anything else, the sooner you address these problems, the better they are managed and or resolved overall. Oops. So, what changes as we go through the menopause? Well, as our sex hormones, estrogen, progesterone and testosterone fluctuate and deplete, it can affect many different systems in the body. There are lots of different symptoms we may experience, such as flushes, night sweats, mood changes, muscle and joint aches, poor sleep, palpitations, to name a few. But we may also experience and see some changes in the genitourinary systems due to the volume of estrogen receptors in this area. So whilst we work with you to look at your urinary, bowel, pelvic organ and sexual function, as physios, we are also movement specialists and look at the importance of strength and function, especially in this time of life. We are living about a third of our life in the menopausal years. Let's make sure that we remain functional and fit and turn up as we would like to. So take-home tips. For your bladder, drink 1 to 2 litres of clear fluid daily. Minimise your fizzy, caffeinated alcoholic drinks. And a myth busting is really restricting fluids does not stop you leaking. It just makes your bladder more irritated. Don't just in case wait. Go for a wee when you need one, and don't power wait, try and push that wee out. Take your time and have a wee. You're entitled to go to the toilet. Bowels, stay hydrated. Look at your fibre content. Are you getting both types of fibre in your diet that help that stool move through the colon? Use a small stool to put your feet on when you go to the toilet to open your bowel, so your knees are slightly higher than your hips. And this allows a clearer passage out through the rectum. Don't ignore the call to poo. If you do, things just dehydrate more and become more solid and more difficult, and that can cause constipation. And definitely don't strain. You shouldn't be bleeding or having pain during going to the toilet. Seek help if you are struggling. And prolapse. If you have been diagnosed with a prolapse or suspect you may have one, try to avoid prolonged static standing. Exhale with effort, such as lifting, push and pull and things like that. Being overweight can add to these problems, so losing a couple of pounds can make a big difference. And don't strain on the toilet, because that downward pressure will add to the problems of prolapse and the symptoms that you're experiencing. And then pelvic floor muscles. How many are you doing? How many of you do pelvic floor exercises regularly? How many of you know how to do them? So the pelvic floor muscles need to be able to contract, tighten, release and relax. So try to gently squeeze and lift the back passage. Release and let go, as though you're stopping wind. If you are a visual person, imagine picking up a blueberry with your back passage. Take it to visit your pubic bone. Don't squash it, let it down and release. Don't squeeze your bum cheeks. Keep your tummy muscles soft. Don't hold your breath. Make sure you fully release before you do your next squeeze and lift. Doing some pelvic floor muscle exercises consistently will keep these muscles mobile, strong, and in good working order. But if you do still experience any issues we have discussed, go and get some help. Speak to a healthcare professional and get yourself some help. At this point, don't let it get too far. So last but not least, sounds silly, but we sometimes forget to breathe. Taking a few deep belly breaths and long out breaths regularly throughout the day, this will help decrease stress, relieve muscle tension, and get your diaphragm, tummy muscles and pelvic floor moving well together. We take on average 25 to 26,000 breaths a day. That's a lost opportunity to use them muscles. If we can do it effectively, taking a couple of deep breaths takes us a moment and can make a lot of difference. Movement is good for the body. During the menopause, everything has a tendency to feel a little less mobile, a little more stiff. Motion is lotion. Find something you enjoy and do it regularly. The more ways we move, the better. And as we move, so do our pelvic floor muscles. If you get pain, leaking, or heaviness with movement, this is your body's way of saying it needs a bit of help, not to stop moving. Finally, let's try to rewrite the menopause narrative. We are not grey-haired old women content to sit at home and waste away. We are strong, independent women who are navigating their way through a transitional period. Let's try and support each other, keep having these conversations, and seek help when we need it. Thank you for listening, and I'm going to cover some questions with Bernie now.
Thank you, Jackie. That was fantastic. Yeah, I've just got a couple of questions. So how do we refer to pelvic health physio? How do we refer into you?
If you have a GP with a St Helens postcode, they have a direct referral straight into pelvic health physio. Otherwise, your GP would have to refer you into your consultant, urologist, gynecologist, or colorectal consultant, and then they can refer you straight through to us.
Thanks, Jackie. And then, as well as your team, are there any other specialist menopause clinics we can refer into?
So in our trust at the moment, we're developing a special menopause clinic, and that's going to be run by Claire Stewart, one of our obs and gynae consultants. She's the lady at the moment, the go-to lady with anyone with having any menopausal problems and symptoms from that, and hopefully within the next 6 months we should see that specialist clinic set up.
Thank you. And just talking about like hysterectomy, if someone's had a hysterectomy, including having the cervix removed, can you still have a prolapse?
Yeah, so a prolapse is a movement of one of the pelvic organs, and you've got three main pelvic organs. You've got your uterus that sits above the vaginal canal. So if you've had a hysterectomy and that's been removed, what can happen is the top of the vaginal canal can sink in, and that's classed as a vaginal vault prolapse. You can also have some movement of the bladder into the front wall of the vagina, and that's classed as a cystocele, a bladder prolapse. And you can have some movement of the rectum at the back of the vaginal wall, and that will be classed as a rectocele. Or you can have a combination of these as well.
Mm. So I suppose if you've had hysterectomy, it's really doubly important you do your pelvic floor exercises then, isn't it?
So your pelvic floor is the support from underneath, but as long as you're doing them pelvic floor exercises properly, and you're keeping them pelvic floor muscles strong and mobile, and you're not just gripping them all the time, that can really help support everything from underneath. And then obviously lifestyle things as well, keeping yourself fit and healthy and things as well.
Oh, great. So how do I know if I'm doing the exercises correctly, and are the machines that can help as well?
Yeah, so you can get pelvic floor exercise machines if you like. You can get lots of things now that attach to your phone, and they do all weird and wonderful things, and you can play games with those things. Some people like that, and that's feedback. So biofeedback is anything that tells you you're doing something, so you can see it visually, you can feel it, you get some sensation from it. You don't have to go out and spend money on these machines, but some people like them. So it's very much dependent on you. And as long as you're not getting any pain or irritation or that, there should be no problem for you using these machines. But if you wanted to get checked by pelvic health physio first, or one of your consultants, to check that everything was okay and it was okay to use them machines, that would be great. But what you want to feel is to be able to feel their muscles around the genital area, mainly the back passage, to be able to squeeze lift up and in, release and relax. And as long as it can do all 4 of them things, that's a general pelvic floor exercise. And then you can work on endurance by being able to squeeze and lift and hold, keeping your tummy muscles soft and your breathing gentle, and see if you can hold it for several seconds, fully release and relax, and then do that again. And that will work on the endurance of them muscles as well.
Thanks, Jackie. I love the blueberry image that you brought up there.
Hates me saying that because everyone loves blueberries and they're like, oh no,
I'll never eat them again. Oh, thank you. That was amazing talk there. So if anyone has any further questions for Jackie or about menopause in general, you can join our bi-monthly menopause cafes, which are on Teams at the minute, and Jackie will be coming to those as well. So if you email us at Wellbeing Events, and we will send through the dates for those. But thank you for listening today. Bye.